These are the top 5 supplements you should be taking to heal L4, L5 disc bulges, sciatica, and low back pain fast. And number 4 is a must-have for lasting relief. Why should you listen to me? I'm Dr. John Zielonka, the author of the Amazon bestseller, The Science of Vitamins Meets Optimal Health and Common Sense. With 30 plus years of experience and 16 consumer and top choice awards, I've helped thousands of patients from Olympic athletes to everyday people heal back and spine pain using our proven 7-step method protocol. One of our key steps includes targeted nutritional support. Supplement number 1 is omega-3 fatty acids. Omega-3 fatty acids are essential fats that our bodies cannot produce on their own, so we must obtain them from our diet or through supplementation. They're found in foods like fatty fish, such as salmon, flax seeds, chia seeds, walnuts. These fats play a crucial role in reducing inflammation, which is a key factor in conditions like disc bulges, disc herniation, sciatica, and general back pain. When a disc in the spine bulges or herniates, it can press on nearby nerves, leading to pain and discomfort. This pressure often triggers an inflammatory response, causing swelling and further irritation of the nerves. Omega-3 fatty acids help to counteract this inflammation. They achieve this by influencing the production of molecules in the body that are called eicosanoids, which are involved in the inflammatory process. By promoting the creation of anti-inflammatory eicosanoids while reducing the production of pro-inflammatory ones at the same time, omega-3s can help decrease inflammation and consequently reduce pain. Additionally, omega-3s support overall nerve health. They don't just work on inflammation, they also help with nerve health. These are integral components of cell membranes, including those of nerve cells. By maintaining the integrity and fluidity of these membranes, omega-3s facilitate effective nerve signal transmission, which can help alleviate nerve-related pains such as that experienced in sciatica. For therapeutic effects, the recommended dosage of omega-3 fatty acids is typically 2,000 to 3,000 milligrams of combined EPA and DHA per day. This dosage can vary based on individual needs, obviously, so it's a good idea to consult with a healthcare provider who understands nutritional supplementation well before starting omega-3s or any of the supplements that I talk about today. Now, the best way to take your omega-3s are with food. They're far better absorbed when consumed with a meal that contains some fat. Opt for high-quality fish oil supplements. Look for products that are molecularly distilled to remove contaminants like mercury, for instance. Divide the dose. Split the daily dose into 2 servings, morning and evening, or breakfast and lunch, to reduce the potential side effects like fishy burps and maximize absorption throughout the day. Now, incorporating omega-3 rich foods like fatty fish, your salmon, your mackerel, your sardines, into your meals 2 to 3 times per week can complement supplementation and enhance your overall benefits. Now, incorporating omega-3 fatty acids into your regimen through supplementation or diet can help reduce inflammation, support nerve health, as we've talked about, and alleviate pain associated with disc bulges, herniations, and sciatica. Regular use paired with right dosage and timing can make a significant difference in your recovery journey. Before we move on to supplement 2, I want to make sure you stay with me till the end because I'll share some of the best vitamin and mineral complexes that incorporate these top 5 supplements, making it much more convenient to get everything you need for healing and recovery. Supplement number 2 is vitamin D3. Now, vitamin D3, normally we just say vitamin D, and what we mean is really D3. There are different forms of D, but D3, also known as cholecalciferol, plays a crucial role in bone health and muscle function, making it particularly beneficial for individuals dealing with disc bulges, disc herniation, sciatica, and low back pain. Vitamin D3 aids in calcium absorption. It's essential for maintaining strong bones. It supports the structural integrity of the spine. Adequate levels of vitamin D3 can help prevent bone-related issues that may make your back pain worse. Additionally, vitamin D receptors are present in muscle and nerve tissues, indicating its involvement in neuromuscular function. Sufficient vitamin D3 levels can help reduce pain and improve muscle strength, potentially alleviating discomfort associated with sciatica and back pain. Now, the recommended daily intake of vitamin D3 varies, obviously, on age, health status, your exposure to sunlight. For adults in Canada, a common recommendation is 1,000 to 2,000 international units per day. However, some individuals may require higher doses to achieve optimal blood levels, especially those with limited sun exposure or existing deficiencies. Now, this is one of my biggest pet peeves. I'm not supposed to tell you this, but when I go to conferences down in the US, and I do more international conferences than most docs ever will, is they laugh at me when I tell them about the rules in Canada. So for many, many years, the maximum limit for vitamin D was 1,000 IU. If you go down into a Walmart in Buffalo, though you can buy these in 10,000 IU units. In the past couple of years or so, that was raised to 2,500 IU. Most people are sorely lacking in their vitamin D. The best way to do this is actually go get tested, go spend $35-40, find out what your vitamin D levels are, but everyone should be taking extra vitamin D. The best way to take it is with a meal. Again, vitamin D3 is also fat soluble, meaning it is better absorbed when taken with a meal containing some fat. Taking your supplement with the largest meal of the day can enhance absorption. You need to be consistent. Taking D3 at the same time each day can help establish a routine and improve adherence to supplementation. One of my favorite sayings is vitamins work. The only requirement is that you actually take them. So one of the things you might want to do is put your vitamins, if you are a coffee drinker, most are, I'm not, put your vitamins right beside the coffee maker so you can't forget not to take them, right? Supplement forms, vitamin D3 supplements are available in various forms, capsules, tablets, liquid. I prefer the liquid where a single drop is 1,000 IU, just make it so easy. Choose a form that's convenient and aligns with your convenience and your preferences. Incorporating D3 into your daily regimen alongside other treatments and lifestyle modifications can support the healing process and provide relief for disc-related pain and sciatica. Supplement number 3 is magnesium glycinate. So magnesium glycinate is a highly absorbable form of magnesium, which plays a vital role in muscle and nerve function, making it beneficial for individuals dealing with disc bulges, herniation, sciatica, and low back pain. Magnesium is essential for muscle relaxation and nerve transmission. Adequate magnesium levels can help alleviate muscle tension and spasms, which are common contributors to back pain and sciatica. Additionally, magnesium supports nerve health by regulating neurotransmitters that send signals throughout the nervous system, potentially reducing nerve pain associated with disc issues. The recommended daily allowance for magnesium varies by age and sex. For adults, it's typically around 400 milligrams. For adult females, around 300 milligrams. When using magnesium glycinate supplements, a common dosage then is 1 to 400 per day in milligrams, depending on individual needs and tolerance. It's advisable to start with a lower dose and gradually increase it, monitoring for any adverse effect. Now, the best way to take your magnesium glycinate, again, is with food. Taking magnesium glycinate with meals can enhance absorption and reduce the likelihood of gastrointestinal discomfort. Again, it's always best to divide doses. Splitting the total daily dose into 2 or more smaller doses throughout the day can improve absorption and maintain steady magnesium levels. You need to be consistent. Taking the supplement at the same time each day helps establish a routine and ensures that consistent magnesium levels are in the body throughout the day. Incorporating magnesium glycinate into your daily regimen alongside other treatments and lifestyle modifications can support muscle relaxation, nerve health, and overall recovery from disc-related pain and sciatica. Supplement number 4 is turmeric. Now, here's a little pet peeve. It is turmeric, not turmeric. There are 2 R's in it, versus curcumin, which gets you the longer sound of the U. But as I mentioned in the introduction, turmeric is a must-have for lasting relief. Turmeric, particularly its active component curcumin, is renowned for its potent anti-inflammatory and antioxidant properties. It makes it beneficial for individuals dealing with disc bulges, disc herniations, sciatica, and low back pain. Curcumin helps reduce inflammation by inhibiting molecules that play a role in the inflammatory process. So this reduction in inflammation can alleviate pain associated with nerve compression from disc issues. Additionally, curcumin's antioxidant properties combat oxidative stress, which can damage cells and tissues, further supporting the healing process. For therapeutic effects, a common recommendation is 500 to 2,000 milligrams of curcumin per day, divided into multiple doses. It's important to note that curcumin has low bioavailability, meaning it's not easily absorbed by the body. To enhance absorption, it's often combined with piperine, an extract from black pepper. Hence, the best way to take it is for a supplement that also contains some black pepper or some piperine to enhance the absorption. Again, you want to take it with meals. Taking curcumin with meals, especially those containing fat, can improve its absorption due to its fat-soluble nature. Again, you want to be consistent with the timing. Taking the supplement at the same time each day helps maintain steady levels in the body. Now, again, this is important for some people, depending what type of drugs, medication you're on. Turmeric may pose a problem for you. So again, always please check with a qualified health provider. Incorporating turmeric or curcumin supplements into your daily regimen alongside other treatments and lifestyle modifications can support the healing process and provide relief from disc-related pain and sciatica. And supplement number 5 is glucosamine. Now, I want to make a side note here. A lot of people often pair glucosamine with chondroitin sulfate. Chondroitin sulfate will definitely have benefits. The problem is that sometimes it's not absorbed into the cells as well as it should. So let's focus on glucosamine here. Glucosamine is a natural component found in cartilage, the tissue that cushions the joints. It's commonly used as a dietary supplement to support joint health and may be beneficial for individuals dealing with disc bulges, herniations, sciatica, and low back pain. Glucosamine is believed to support the repair and maintenance of cartilage. It stimulates the production, the essential components of cartilage structure. It may help slow the progression of cartilage degradation, alleviate the pain associated with joint and disc issues as well. A common dosage for glucosamine is 1,500, that's 1,500 milligrams per day. It can be taken as a single dose or divided into multiple doses throughout the day. Again, the best way to take glucosamine is with meals. Take glucosamine supplements with meals that can help reduce the likelihood of gastrointestinal discomfort. Again, you need to be consistent. Regular daily intake is important as the benefits may take several weeks and actually typically several months to become noticeable. Remember, we're trying to rebuild disc and cartilage. You need to take quality supplements. So choose high quality supplements from reputable manufacturers to ensure purity and potency. Incorporating glucosamine into your daily regimen alongside with the other treatments and lifestyle modifications may support joint health and provide relief from disc-related pain and sciatica. Omega-3 fatty acids, vitamin D3, magnesium glycinate, turmeric containing curcumin, glucosamine. These are the top 5 supplements to support healing, reduce inflammation, and provide lasting relief from disc bulges, disc herniations, sciatica, and low back pain. There are more, and they need to be specific to you. That's why you need to see a qualified health professional who not only is an expert in understanding all these low back and neck conditions, but also in vitamin supplementation as well. Now, important point, while you can take these supplements individually as standalone options, there are high-quality complexes available that incorporate a combination of these supplements along with other supportive vitamins and nutrients. Now, this is important. These complexes are designed to provide a more comprehensive approach to healing and recovery, making it easier to get the benefits of multiple supplements in one convenient product. But it's not just that it's more convenient, is understand vitamins work hand in hand. So when it comes to the natural healing of the body, we often want to take that simplistic medical approach. For instance, where we say, okay, I have a cold, I'm going to take vitamin C. Well, there are multiple different vitamins and supplements that can actually help with that cold. And some of those vitamins and supplements actually support other vitamins and supplements. For instance, that's why you always take vitamin C and vitamin E together. They actually regenerate one another. So this is important. You don't want to take that singular medical approach. When you do that, it's really no difference than taking a single drug for a single problem. What you want is you want something that's going to improve the overall health of the body. So these combinations become very important. So vitamins and minerals require cofactors. So by getting into the complexes, we're much better off for the body. These are the ones that I recommend to my patients in my office, specific to the 5 that we've talked about today. So when we're talking, for instance, when we're talking the glucosamine, is I love the Core Science OA Max, because it's not just going to have the glucosamine in it, but it will have MSN. It will have a variety of different enzymes that will actually help support the body. It will actually have a number of cofactors that allow that glucosamine to be absorbed that much better as well. When it comes to the magnesium glycinate, my favorite by far is magnesium 7. This is the only product that has a combination of 7 different forms of magnesium. There is one other on the market, but they're not the same form. So there's a different form that will help with muscle. There's a different form that will help with nerve. There's a different form that will actually help with sleep. And when the body's trying to repair it, guess what? We need our sleep. We need that time to repair. It's the only Mag 7 that actually has magnesium 3 which is the only form of magnesium that will cross the blood-brain barrier as well. When it comes to EPA, DHA, or your omega-3s, a number of different forms. The Core Science form is a great form, as it was for the OA Max, and for the Mag 7, there's a great Core Science form for the omega-3s. Pure Encapsulations makes a good one. Metagenics makes a good one. Designs for Health makes a good one. You want a really good quality supplement. Unfortunately, there are a lot of supplements out there that do not have the quality. You get what you pay for, and simply paying more doesn't always mean it's a better product, but that's a starting point. More about that in a second. When it comes to the vitamin D drops, again, I prefer the liquid form. So whether that is the Core Science great form, the again, Pure Encapsulations, Metagenics, they all Designs for Health, they all make good forms. Again, getting back to why you need to combine things, ideally you should be taking your vitamin D with K2 at the same time. Because again, that these things hand in hand actually serve a purpose. So we want to look for the combinations, and we want to look at our overall health, And then we want to look at the quality of the vitamins. So again, I get off on a bit of a tangent here. There is only one scientist who truly independently rates all the vitamins each year. And when he first did this, it was probably a good 10 to 20 years ago. And he looked at 1,500 different products. Another 1,500 different products. He rated them all on a 5-star rating. You want to guess how many got a 5-star rating? 4 out of 1,500. Today it's better, but still less than 1% get 5-star ratings. So the ones you're buying in the drugstores, the one-a-days, the Centrums, the Life Dailies, they're ranking half a star to 1 star out of 5. Please look for quality. Go to a good health professional who understands this stuff well. We only deal with the 5-star labs that produce these things, and we look upon how to improve that as well. Now, to get a more in-depth explanation of vitamins and supplements, go check out my book, The Science of Vitamins Meets Optimum Health and Common Sense. It's available on Amazon. The first edition was written, 12 years ago. Okay. The new updated version came out in 2020. Okay. Again, The Science of Vitamins Meets Optimum Health and Common Sense. It's available on Amazon. It will tell you all of these things, a combination of exactly what you should be taking, what the good science actually says. It was a bestseller on Amazon. If you have any questions about these supplements, drop them in the comment section below. If you found the video valuable and learned something new about supplements for disc and nerve healing, please like it. Please share the video. There are a lot of people living with stuff they don't need to live with. They're just not getting great information out there. We can help others on their journey to pain-free living. And don't forget to subscribe if you're looking for more proven tips and strategies on how to treat and relieve debilitating back and neck pain without relying on drugs or surgery. The next video you should watch is this one right here. You'll learn all about a 7-step non-surgical treatment for disc bulges, disc herniations, sciatica, stenosis, and other spinal degenerative disorders. Please go watch this video right now.